Just when we thought we were done with COVID, another one is rearing its head. It's called diphtheria. The NCDC in Nigeria has reported some confirmed cases of diphtheria and a few deaths as well in Nigeria. So far, there has been reports of 100 cases in Kano with 32 deaths. In Lagos, there's been 5 cases with 3 deaths. In Yobe, there has been 17 cases with 3 deaths, and in Osun State, there has been a confirmed case, but no death reported yet. Well, what we have to do is know how to prevent it, know how to avoid it, and even understand what that disease, diphtheria, is. And that is why we're having this discussion today. So, what is diphtheria? Diphtheria is a bacterial infection caused by a bacteria called Corynebacterium diphtheriae, and it can affect the throat, the nose, and the skin. Diphtheria can be spread through coughing, sneezing, or coming in contact with contaminated items or the wounds or lesions of somebody who is infected. And within 10 days, the person who has come in contact with this bacteria can begin to show signs and symptoms. The risk of infection with diphtheria is higher among children and adults who were not immunized against diphtheria, or among healthcare providers like nurses and others in the medical sector. The symptoms include fever, runny nose, sore throat, cough, neck swelling. Sometimes there can be a thick white patch at the back of the throat, that is on the tonsils. There can also be difficulty with breathing. There can be complications such as damage to the heart, to the kidneys, and blockage of the airways, and in some really bad cases, it can lead to death. Happily, the risk is lower if a child has been immunized at 6 weeks, 10 weeks, and 14 weeks. That vaccine is called Penta. I'm sure many mothers may be familiar with it when they go for immunization and they hear Penta. One of the vaccines included in that Penta is diphtheria. So how can we protect ourselves? Parents should ensure that their children are adequately immunized. We also want to ensure that we isolate any persons who are showing symptoms that suggest that they may have diphtheria. Hand washing is very important. In fact, we cannot overemphasize the need for regular hand washing and general hygiene. We should avoid sneezing or coughing openly, and also avoid touching wounds and lesions on anybody. And if for any reason we have come in contact with these things, we need to wash our hands thoroughly with soap and water. Diphtheria can be treated with diphtheria antitoxin and antibiotics. So anybody who is showing symptoms of infection with diphtheria should quickly report to the nearby hospital and get isolated and properly treated to avoid infecting other people. Till I see you in my next video, continue to stay safe and stay healthy. I remain Grace Obunaya, your pharmacist and health coach. Remember to subscribe to this channel, Care Zone. Bye.